Are you struggling with heavy menstrual flow or lower abdominal pain or pelvic pain? Or has someone mentioned that you've got lumps in the womb? Then this is a video you must watch. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. Today we will talk about fibroids. So what are fibroids? Fibroids are non-cancerous growths that occur in the muscle wall of the uterus or the womb. Depending on where they are located, they are given fancy names. So as you can see in this model, we have these are the fibroids. So they are the clumps present within the muscle wall of the womb. Depending on the location as mentioned earlier, so if they are located within the muscle wall, they're called as intramural. If they are located within the womb cavity, it may be mucosal or submucosal, just below the muscle, between the muscle and the mucosa. If it is present on the outer surface, it can be called a subserosal. 80 to 90% of the time, fibroids are asymptomatic, as in it may not cause any trouble at all to you. It may be an incidental finding, so you go and have an investigation done for some other purpose or pain or heavy menstrual bleeding, it may be found. At the same time, it may also cause symptoms like heavy menstrual bleeding, pelvic pain, lower abdominal pain, or discomfort during sexual intercourse, or occasionally it can also cause lower back pain depending on the location. Some of the symptoms that may be caused by fibroid, which is rare, is infertility. So a woman may struggle with falling pregnant, not directly related to the fibroid itself, but the location of the fibroid may interfere with the woman falling pregnant. But it is also worth looking at other causes of infertility if you are someone who's struggling with falling pregnant. How are fibroids diagnosed? Very, very simple investigation is an ultrasound of the abdomen and pelvis. So the ultrasound will tell us not only the anatomy of the reproductive organs, obviously it will tell us the pathology if it is there. It does make it difficult if a woman has got fibroids, because fibroids don't allow the ultrasound waves to pass through them. So there may be difficulty, especially if there are multiple fibroids, but it is still one of the best diagnostic tools available to us to diagnose fibroids. And as mentioned before, depending on the location of the fibroid, then we give it its name. And from there, the treatment options are decided as to what is the best course of treatment for you. When does fibroid need to be treated? 80% of the times, fibroids don't need to be treated. But the other 20%, yes, it needs treatment. So what are the indications for treatment? First of all, severity of symptoms, as in if the woman has got heavy menstrual bleeding, then yes, the fibroid may be the cause and it may need to be treated. Secondly, if you are in the reproductive age group planning for pregnancy, and if we find that there are many fibroids interfering with a woman falling pregnant, then it may need or require treatment. So the size, number, location, and where you are in your reproductive age group all would determine the further course of treatment of fibroids. So what are the treatment options available for fibroids? Now, as mentioned before, if they are not the direct cause of the problem, then the treatment of the underlying cause is done. Generally, heavy menstrual bleeding, yes, there are medical management and surgical management available. Medical can be like hormonal therapy or non-hormonal therapy. Non-hormonal therapy is usually used to reduce the amount of blood loss, and hormonal therapy also is used to reduce the amount of blood loss. So there is a choice between the two. Depending on the response, you can choose which one you want to continue with. Some of the medical management are under specialist guidance, so please seek appropriate advice from the appropriate health professional if it is something that is required for you. What are the surgical options? So sometimes surgery may be required to remove the fibroid. So like mentioned before, if the fibroid is within the womb cavity and it is causing heavy menstrual bleeding or spotting or bleeding in between the cycles, it may need to be removed. And how can that be removed? A simple procedure called hysteroscopic removal. So a camera is inserted within the womb cavity and the fibroid is removed under direct vision. So that is one form of removal. Now, if a woman has completed the family and does not require the uterus anymore, sometimes the hysterectomy may be one of the options that may be offered to you. Some of the minimally invasive treatments that are available are ultrasound-guided high-frequency ultrasound therapy or uterine artery embolization. But again, please seek appropriate advice from your own health professional to see if this is suitable for you. If you'd like more information, please visit the website